The liver can be hurt by thousands of different medications and substances. It is caused by drug-induced liver injury, DILI, or toxicity. The liver is very important for drug metabolism. Thus, drug poisons commonly affect this region. DILI is liver damage caused by poisons present in medicines. The illness may be a short-range or ongoing reaction to the toxins. The toxins in the molecules may be brought up artificially or organically. Intrinsic and idiosyncratic DILI both exist. Because the injury is intrinsic, it is simple to foretell and proceed because it's held on the dosage. The latency period is likewise short. Below are 5 drugs that can lead to liver damage when taken in excess portion or without a doctor's prescription. 1. Ibuprofen. 2. Amoxicillin clavulanate. 3. Amiodarone. 4. Valproate. 5. Paracetamol. The most frequent cause of intrinsic DILI instances is paracetamol, also referred to as acetaminophen. The drug's metabolism by the liver has the ability to produce large amounts of reactive metabolites, which kill cells and other body tissue. The central cause of DILI is any medicine that can hurt the liver. Moreover, the cause of the disorder is different depending on whether it is intrinsic or idiosyncratic. Drug dosage is a major contributing factor when a condition is intrinsic. Idiosyncratic DILI depends on the confluence of risk factors related to the medication, the environment, and the user. If a doctor discovers that a patient has DILI, they will stop the use of the medication, which is the cause. The doctor may also remove the medication that is harming the patient's system.